At AACR, we present the results of the INVOKE-10. It's a phase 3 double-blind randomized trial of atezolizumab after definitive treatment for patients with locally advanced head and neck cancer. The treatment of patients with locally advanced head and neck cancer being treated in the curative intent setting does involve surgery, radiation, and chemotherapy. The standard of care for patients after completing definitive treatment is usually observation. The aim of the INVOKE-10 study was to assess the efficacy and safety of atezo compared to placebo in patients with locally advanced squamous cell carcinoma of the head and neck who have not progressed after completing multimodality curative definitive treatment. We elected to enroll patients with high-risk head and neck cancer. The primary endpoint of the trial is investigator-assessed event-free survival, and secondary endpoint is central review, event-free survival, and overall survival and safety. Now, in terms of how these patients were treated before randomized to atezo or placebo, and this is an important point, 40% of the patients, or close to 40% of the patients, were treated with primary surgery. For the primary endpoint of investigator-assessed event-free survival, unfortunately, the study did not reach the primary endpoint, 67% in the atezo arm versus 63% in the placebo arm, and we saw the same numbers with the central review EFS. When we look at the overall survival, we were actually quite surprised that we saw an excellent overall survival in both of the arms. This study, albeit negative, would really help us think, how do we design the next trial in head and neck cancer, and how do we incorporate immunotherapy in the curative treatment of head and neck cancer patients? We know that checkpoint inhibitors help patients with recurrent and metastatic head and neck cancer, but as of now, we have not been able to clearly define the role of a checkpoint inhibitor in the curative treatment of head and neck cancer patient. The other point that really we did not pursue in this trial that we can think about going forward is some biomarker selection in how we select patients to enroll in adjuvant trials in head and neck cancer. So this really study does not change the current standard of care for patients with locally advanced head and neck cancer, but hopefully will guide us on how we design future trials in the curative setting in patients with locally advanced head and neck cancer.